Hello, my people. Today, let we talk about hematology. Hematology is a study of blood and blood-forming organ. So, in the blood is composed by cells and plasma. Within the cells, we are having white blood cells, red blood cells, and platelets. So, among all of those components of the blood, all of them they can have abnormality. Today, we are talking about red blood cell abnormality, specifically iron deficiency anemia. As the name indicates, it means iron is not there. So if the iron is not there, there will be no hemoglobin. And if there is no hemoglobin, also red blood cells will not carry its function of carrying oxygen to the tissue. And remember, hemoglobin is the one which binds oxygen, so that red blood cells, if it reach the tissue, they will provide oxygen so that respiration can occur. So before talking much, let we have a look on the hemoglobin synthesis, but a little bit because it is not the story of today. So story start by talking about succinyl coenzyme A, which react with glycine in form of in the presence of ARA synthase as enzyme, and paradoxal phosphate as vitamin B12 as cofactor. The next, it is alpha amino beta adipic acid, where in the presence of ARA synthase they form aminolevulinic acid. In the presence of ARA, the hydrogenase is going to form profibrinogen, and profibrinogen is going to provide protoporphyrin 9. So our game is here on the ferrous iron. This iron will be there to react with protoporphyrin 9 so that you can have heme, and this heme is going to require hemoglobin, which is amino acid, and this globin is globin and heme, they form hemoglobin. So this hemoglobin, if it is formed in a normal way, red blood cells will carry oxygen as in a good way. But in the deficiency of this iron, maybe you are not eating, maybe you are having chronic infection where you have anemia of chronic disease, where ferritin or the storage of iron is not being released easily so that you can make hemoglobin. That is the story of iron deficiency anemia. So when you have iron deficiency anemia, you are going to have symptoms like pale. This is the normal. You see there is the there is presence of reddishness here. It is pale. That means that you are anemic, but you are going to have a look in detail the clinical signs and symptoms, lab findings, and so on. So this is what I was talking about. This is those are signs and symptoms. You will have time to look on them. So we can continue. Before we proceed, I have case study for you here. Means after this video, you are going to read this case study, and it will be like piece of cake. But if you have the answer, you can leave in a comment so that if the answer comes, you are going to be blessed because you are the one who have correct answer before even I proceed. So here I have some hint which can direct you. You are having the patient having fatigue and pallor. So there is menstruation bleeding. There is nail which is in spoon shape called coira nichia. So the hemoglobin is 8.5. Hematocrit, as you are seeing here, it is microcytic. Okay, it is low because the normal range it is 80, 200. So we are having pencil cell, and also you are going to see serum ferritin, iron, and total ITBS, total iron binding capacity also increased. Means what is likely diagnosis. So please comment below. Let me start iron deficiency anemia. So normally, iron deficiency anemia is most common type of anemia worldwide. So it is caused by adequate iron, as I said previously, in synthesis of hemoglobin. There is no iron which is leading to reduced hemoglobin synthesis, and now it results in microcytic anemia, hypochromic anemia, to mean that the size, microcytic, the size is below, means the MCV is below 80 femtomen, and hypochromic to mean that the color or hemoglobin is not enough because there is no any iron. So it is most commonly in the woman. This red blood cell, you see, it is very small. This is microcytic, and this red blood cell, you see, the central parole means the redness. It is very small. That means that there is no amount of hemoglobin to be there is not normal. It is very little amount. So there is the most common in women, children, and pregnant women, as I said. So clinical symptoms, normally any kind of anemia, because they are going to make red blood cells either abnormal or decrease. Means red blood cells is not carrying oxygen to the tissue as a normal way. That's why you have fatigue, weakness, pallor, and dyspnea. So there is other symptoms which is very special for iron deficiency anemia, means they are unique. In the case study, when you see spoon-shaped nail, means or coilonychia, these symptoms is specific for iron deficiency anemia. There is angular cheilitis and glossitis, means there is smooth foul tongue, means angular cheilitis, your mouth, you are having some ulcers. So also there is hair loss and blighter nails. So there is a good syndrome which is supposed to be known on this iron deficiency anemia. It's called Palmer-Vinson syndrome. This syndrome is characterized by iron deficiency anemia, to mean that laboratory findings, you're going to have the dyspnea, weakness, pallor, and so on. Even your nail going to be in spoon-shaped. But also, whenever you see there is what you call patient is having what you call dysphagia, means the eating is not properly. They are going to have due to esophageal web, means there is difficulty in eating, and also there is going to be esophageal web in upper esophagus. So this syndrome, if they give you the question having the iron deficiency anemia and you are seeing dysphagia, esophageal webs, this triad is indicating Palmer-Vinson syndrome, but it is here because also it includes iron deficiency anemia. So we can continue by seeing how the laboratory findings. So laboratory findings we are having on CBC, decreased hemoglobin, hematocrit also decreased, MCV also decreased. That's why it is microcytosis. We are having MCHC mean corpuscular hemoglobin also decreased. LDW is increased, to mean that there is anisocytosis, means red blood cells, their size are in a different way. So let's go on the peripheral blood smear. On the peripheral blood smear findings, as I told you, you will have microcytic, hypochromic, and RBC. Anisocytosis variation in the size. You see this one is small, this one is big, this one is normal, means they are going to be the garden pathy appearance, means each RBC is having, there is variation in size. Also pyrexocytosis variation in shape. See, this one is somehow round, this one is small, oval, like that, means even the size is the anisocytosis, shape is pyrexocytosis. So also pencil cell RBC can be observed, elongated RBC, but in this image there is not there. So you can wonder the confirmatory test. You can do serum ferritin, which is most sensitive and specific, is decreased. There is decreased serum iron, as we are talking about, is the iron deficiency anemia, but total iron binding capacity is increased. Why? Because there is no iron. Transferring the capacity to bind iron is increased because there is no iron. That's make this transferring hunger. Now they increase total iron binding capacity. So there is transferrin saturation. Transferrin is the protein which transport iron in the serum, in the blood. So this one, because there is no any iron, its saturation or its combination combined form with iron is not there. So here there is the table which is showing the normal ranges of the serum ferritin, serum iron, total iron binding capacity and transference saturation, so that if they give you case studies without the normal ranges, you can know that serum iron decreased or serum ferritin is decreased. So there is a question many students is asking themselves: the difference between iron deficiency anemia and the anemia of chronic disease, because all of them there is no iron to make hemoglobin. So why? But the cause is difference. So it is better to recognize this, because you can get 0 on the case study and answering anemia of chronic disease, yet it is iron deficiency anemia. So there is parameter. Ferritin in iron deficiency anemia is decreased, but anemia of chronic disease, ferritin is normally increased or normal. But iron deficiency anemia, always ferritin is decreased. This parameter is good to differentiate iron deficiency anemia and anemia of chronic disease. Then iron in the anemia of chronic on iron deficiency, of course, iron should be decreased, but even in anemia of chronic disease, iron is decreased. Why? Because there is the inflammation or chronic infection. Now the iron is not being released from the storage in the ferritin form. So means in the common iron deficiency anemia and anemia of chronic disease, iron also is decreased in both cases. But total iron binding capacity also is another parameter to distinguish the two, because in iron deficiency, this total iron binding capacity increase, while in anemia of chronic disease, total iron binding capacity is decreasing. So by helping of this, you can now know this case study is for iron deficiency anemia or is for anemia of chronic disease. So let's have a look on the case study and see those who are going to get thumbs up from, because they get correct answer from the beginning. So case study is like this. Is showing the fatigue and parole. There will be nail which is in spoon shape nail, which is also called coronachia. There is also MCV. You see, it is decreased, which is below normal range, which is normal range is 80 to 100 fontarita. Also hemoglobin, if you see, is decreased. 8.5 is decreased. Okay. On the peripheral blood smear, they have seen hypochromic. There is anisocytosis. Also, there is pencil cells. So if you see serum ferritin is highly reduced, okay, and also there is a serum iron which is also decreased, but total iron binding capacity is increased. To know if it is increased or decreased, refer to that table. But based on this, only if you see this spoon shape, it is showing the hint. If you see it is microcytic, like everything is decreased, but RDW is increased to confirm anisocytosis. So based on this lab finding, I'm sure everyone is going to speak with me. It is iron deficiency anemia. So this one is confirmed by seeing microcytic hypochromic anemia with low serum iron, with low serum ferritin, and also iron is decreased, but we've increased the total iron binding capacity and all of those clinical manifestations. So I hope by here no one can miss the case study asking of iron. So I'm glad that everyone will reach here. But also I have another case study which is talking about we are having the chronic infection, which is rheumatoid arthritis. Also the hemoglobin is decreased. We are having also the hematocrit, which is in normal range, in the contrast of the previous 3 case studies. Also we are having the findings of serum ferritin and so on and so forth. So based on the clinical presentation and laboratory findings, what is the most likely diagnosis? This is the case study number 2, which I'm requesting everyone to leave the answer in the comment section. Remember to make subscribe. So this answer of this case study will be in the next video. Thank you so much. I'm glad that I have the friend like you who's going to make subscribe, share, comment. Thank you. Bye bye. See you next video.